Assalamu alaikum. This is Muhammadullah from MLT8 semester cohort University of Science and Technology. Today my presentation topic is about a menstrual cycle. Outline of this topic: what is menstruation, what is menstrual cycle, length of menstrual cycle, phases of menstrual cycle, hormones of menstrual cycle, what are symptoms of getting menses, how much should bleeding during period. What is menstruation? Menstruation is the monthly shedding of the lining of the uterus. Menstruation is also known by the term menses, menstrual period, menstrual cycle, or period. Menstrual blood, which is partly bloods and partly tissue from inside of the uterus. Menstrual bloods flow from uterus through cervix and out of the body through vagina. Menstruation is driven by hormone. Hormone are chemical messenger in the body. The pituitary gland and the ovaries part of the reproductive system. These glands make and release certain hormones at certain time during the menstrual cycle. These hormones cause the lining of the uterus to thicken. This happens so that if a pregnancy would occur, hormone also cause the ovaries to release an egg. The egg move down to the fallopian tubes where it waits from sperm for sperm. If a sperm does not fertilize that egg, pregnancy does not occur. The lining of the uterus break down and shed. This is period menses or menstruation. What is menstrual cycle? The menstrual cycle refers to natural change that occur in the female reproductive system each month during the reproductive years. The cycle is necessary for the production of eggs and the preparation of the uterus for pregnancy. It involves change in both the ovaries and the uterus and is controlled by pituitary and ovarian hormones. Length of menstrual cycle. The normal menstrual cycle range from 21 to 35 days, but different from woman to woman. Only 15% of women will have the classical 28-day cycle. Shorter cycle less than 21 days, longer cycle greater than 35 days. The days between period as your menstrual cycle length. The average menstrual cycle lasts 28 days. Is a 3-day period normal? A period is normal it is if it is anywhere between 3 and 7 days. Well, one of the shorter end of the range, some people have menstrual period for 3 days. This is okay. Phases of menstrual cycle. The specific event that occur during the menstrual cycle are: first phase, menses phase. This phase, which typically lasts from day 1 to day 5, the time when the lining of the uterus shed through the vagina if pregnancy has not occurred. Most people bleed for 3 to 5 days, but a period lasting only 3 days to as many as 7 days is usually not a cause for worry. The second phase is follicular phase. This phase typically takes place from day 6 to day 14. During this time, the level of the hormone estrogen rises, which causes the lining of the uterus to grow and thicken. In addition, another hormone, follicle stimulating hormone, causes follicles in the ovaries to grow. During days 10 to 14, one of the development follicle will form a fully mature eggs. Ovulation. This phase occurs roughly at about day 14 and 28-day menstrual cycle. A sudden increase in another hormone called luteinizing hormone. This hormone causes the ovary to release its egg. This event is ovulation. The luteal phase. This phase lasts from about day 15 to day 28. The egg leave the ovary and begin to travel through the fallopian tubes to the uterus. The level of the hormone progesterone rises to help prepare for uterine lining for pregnancy. If the egg become fertilized by sperm and attach itself to the uterine wall, they become pregnant. If egg do not fertilize by sperm, then estrogen and progesterone level drop and the thick lining of the uterus shed during the period. Hormones of the menstrual cycle. These events that occur during the follicular and luteal phase. Follicular phase. During the follicular phase, the main hormone is the follicle stimulating hormone. This encourages the resting follicle to start developing and maturing, ready for ovulation. This cycle, FSH and luteinizing hormone LH, both are hormones released at the same time from the pituitary gland in the brain. At the start of the cycle, the level of the FSH are much higher than those of LH. As the follicles are mature and then they are producing estrogen, dominant follicle is the biggest and most developed of the follicles. It requires less FSH. This decline prevents the smaller follicle from developing further. The developing follicle produces estrogen. When the estrogen reaches a sufficient level, it encourages the pituitary gland to release more LH. The LH level increases more rapidly from day 12 onwards. This rise also causes the progesterone level to start to rise slightly. This production of progesterone causes a surge in LH level. Around 36 hours following this surge, ovulation occurs. Luteal phase. After ovulation, the corpus luteum forms from the ruptured follicle. This suppresses the pituitary gland and prevents it from releasing the high level of FSH and LH. This phase lasts for around 14 days, and towards the end, the corpus luteum start to disappear. This results in lower level of circulating progesterone and estrogen. It also causes the endometrium to die and be shed and menstruation to start. If fertilization of the egg and implementation has occurred, the progesterone level do not fall. The developing embryo releases progesterone, which prevents the rise of FSH and LH and also prevent the shedding of the endometrium and the period starting. What are the symptoms of getting menses? Some people experience symptoms of menstruation and others do not. The intensity of these symptoms can also vary. The most common symptom is cramp. The cramping her feel and the pelvic area as the uterus contracting to release at landing. Getting periods, mood change, trouble sleeping, headache, food craving, bloating, breeze, tenderness, acne. They can expect the lose between 2 and 3 tablespoons of blood during the period. Some sign of irregular period bleeding are bleeding through pad every 1 to 2 hours, fasting blood clot larger than a quarter, bleeding longer than 7 days each time you have your period. It's normal to experience some variation in the amount of bleeding each cycle. It also important to remember the normal may be different than someone else. Try not to compare with others. Talk to healthcare provider if they are concerned about irregular or severe bleeding during the period. Thank you so much to all.